Hi, my name is Dr. Sar Ahmed. I am a practicing orthopedic surgeon and I have been practicing in the Valley for the last 8 years. I did my advanced orthopedic training through Cleveland Clinic and I did the training in adult reconstruction, which is essentially hip and knee replacement, and a second fellowship in shoulder elbow reconstruction. Today we're going to focus a little bit more on shoulders, specifically shoulder arthritis. Typically, treatment for shoulder arthritis is non-operative, but when that fails, we transition into shoulder replacement surgery. There are a couple different options for shoulder replacements, and we're going to talk a little bit more about it today. I use the latest technology along with the latest implants from Wright Medical Tournier to be able to give my patients the best treatment possible. When we replace a total shoulder, we replace both the ball and the socket. On the ball side, the latest technology involves limiting the amount of bone that we resect. The best way that we can do that is with a stemless option called simplicity. If the bone quality is sufficient, then we can do this replacement, which allows for preservation of the bone so that we have better bone and more bone remaining for the revision surgery. On the socket side, we evaluate the deformity or the loss of bone, and we correct this with the implants that we have available. The best way to assess the deformity that we have is with 3D technology. We use Tournier Blueprint to be able to use a 3D CT scan model, which we can manipulate in real time, figure out the amount of deformity, and correct it with the proper augments. Placement of these implants in the appropriate position can also be done with this Blueprint technology. Once we have modeled our surgery and trialed it, we know not only what implants to use, we know where to put them. This allows for the best results for the patients. If patients have a large rotator cuff tear, then it presents unique challenges. To be able to tackle both problems, we need to have the latest technology, which involves putting in a reverse shoulder replacement. What this involves is taking the ball and putting it on the socket side, and taking the socket and putting it on the ball side. This reversal of the components allows for a mechanical advantage, which allows for range of motion and better postoperative results. If you take the same patients with the same amount of bone deformity, you can see that we would need to augment or replace the bone loss with metal in this case, and the ball goes on top. On the socket side, we would have to put in the stem, just like we would for a total shoulder replacement. As you can see, after we have performed our trial surgery and placed the implants in the correct position, the range of motion postoperatively can also be assessed. This allows for the best results for the patients as well. I appreciate everybody listening and watching the video. Hopefully this was a good recap of shoulder arthritis, various treatments, and latest technology that we use to help patients. As patients come into our office, we are able to go into it a lot more detail and give them more information. Thank you again.